Hello guys, welcome back to Medico Race. So guys, today I've come up with a part 4 video of the Toxic Medical College list for post-graduation, the revised one. But before moving on to the details of this video, guys, there is a disclaimer which is very important. So this video, this list is purely based on the inputs which I have got through the Google form, which I've circulated among postgraduates through my YouTube channel and my Telegram channel. So guys, it is purely based on the opinions given by students, that is, it is subjective. So what is toxicity for one person may not be toxicity for another person, and sometimes faculties might have changed, HODs might have changed, a lot of things might be there. So if at all there is any college or subject which you are interested in this list, then please go there and inquire personally or inquire with postgraduates or undergraduates or staffs, or in whatever means possible. Please inquire about the college before joining. You can use this list for a reference, but purely based on this list alone, don't make your decisions. And I have got a request from many students about releasing the PDF of this. But guys, there is always a problem whenever we release a list of sensitive topics like toxic medical colleges. So once the PDF is released, it goes on like a fire. So guys, it can, since it's a sensitive topic, it can go into troubles. So there are instances where last time I had to remove one of the video itself because sometimes some of the students, they get tensed, a lot of issues can come up. So if at all a video is put up, you can use it for a reference, but once a PDF comes out, it's more difficult, guys. So please try to understand that as well. Now moving on to this video. So as I've discussed, NRS Medical College Pediatrics, there's verbal abuse from head of the department happening several times a week. Then HIMSS Pediatrics Surgery and Orthopedics, there's discrimination based on gender, caste, religion or region, anything among this. So from senior residents and senior PGs and faculty members, which happen several times a week. Next is the Mysore Medical College Pharmacology. There's mental harassment, constant insults and intimidation from faculty members, which happen several times a week. So one of the students has specifically asked me about pharmacology. So this is the list. Hamdard Institute of Medical Science, pharmacology is toxic. So this college is in New Delhi. Here discrimination based on gender, caste, religion, etc. And the toxicity is faced from senior residents, senior PGs, faculty members, and it happens monthly. Next is the GMC Kannauj here pharmacology is toxic, where there is physical abuse like slapping, hitting and physical punishments from the head of the department happening daily. Next is the Jawaharlal Nehru Medical College in Uttar Pradesh, where pharmacology is toxic. Verbal abuse is there from senior residents, senior PGs and administration, and one time an extreme event had happened. Next is Dhanalakshmi Srinivasa Medical College in Tamil Nadu, where pharmacology and forensic medicine are toxic. So there is verbal abuse from senior residents, senior PGs and faculty members happening daily. So the thing is, so most of the location of most of the incidents was in wards or OPDs and sometimes in department office academic sessions. And was the toxic behavior targeted at you or others? Most of the times it was equally both. And impact on your mental health, yes, there is moderate and severe impact in most of the cases. And impact on academic learning, yes, there is significant impact on academic learning and unable to function properly among majority of the students. Then did the toxic environment affect your patient care? Yes, everyone has answered yes itself. So frequently or occasionally it has affected, so there is an affection. Next is, did you report the incident to anyone? So majority of the case, as usual, answer is no. And a few of them who has reported, yes to senior resident, yes to college administration, yes to external authority. And if reported, what was the outcome? So there's no action taken if at all it is reported. And another person, they face retaliation, then again no action taken, no action taken. So it's always no action taken. If at all we go down again, yes, there is no action taken in majority of the cases, and there is faced, most of them, they face retaliation if they have reported. So this is the situation, guys. So if you did not report, what was the main reason? So they have replied that belief that nothing would change and the fear of retaliation. As said this previously also, most of them have marked this. So this is the reason. In your opinion, what changes would help to reduce? So here the toxicity per se of behavior is no issue. Then remove the power of the approving thesis, theory and all from the whoever is in top. PGs should have the power to complain, and if someone has gone through toxicity, then we need to help them. We cannot change the behavior. After doing PG, NMC should take detailed anonymous poll from the students. So require receptive administration and teaching staff. So all these are opinions given by some of the students. Not giving the authority of exam passing and failing to the college or the staffs. Excessive criticism and partiality from the staffs is bad. So more people to work and activities to improve the bones should be there. College administration is very toxic. Equality without showing hierarchy, reducing the work hours, and leave once in 1 or 2 months should be there. The timings can be changed. So mandatory transfer should happen for government colleges. Hierarchy among PGs should be stopped. Don't join minority colleges which are based on religion. Transfer of HOD to other place or is required if he is bad, and I don't think that can ever happen. So all these things are there. So any additional details about the incidents? Yes, it's mainly that you will not learn anything. You need to harass his PG students like hell. He takes bribes and charges lakhs in cash. So senior PG was slapped in front of everyone. I'm from deemed medical college, so completely he uses PG students like his workers. So department looted us, my seniors and all. So administration is very toxic, that for small payment for dropout they put dropouts, and humiliation and abusive language in WhatsApp groups. Ortho resident committed suicide and barely survived. Principal of the college is a psycho. He threatens PGs and MBBS interns. They are not paid stipend properly. So too much money seeking parties are there, and many people were targeted and tortured. HOD has bad eye towards girls. So academic targeting is there, and invasion of personal privacy is there. Publication pressure is there. Psycho personality from the staff is there. So some of them have said nothing past is past. They don't want to say itself. So guys, this is happening in many colleges now. Moving on to the next one. So IHBAS college in Delhi, psychiatry department, there is mental harassment from senior residents, senior PGs and faculty members happening monthly. Next is the mental health center Trivandrum, Kerala, where psychiatry is toxic. So faculty members and administration is toxic. Weekly it happens. Then Jipmar, Pondicherry, here radiation oncology, verbal abuse from senior residents, senior PGs and faculty members happening several times a week. Next is the Akash Institute of Medical Science in Karnataka, radiology, mental harassment is there from faculty members happening several times a week. Next is the Oxford Medical College in Karnataka, where radiology is toxic, verbal abuse from faculty members, head of the department and nursing staff happening daily. Next is the Eras Lucknow Medical College in Uttar Pradesh, where radiology is toxic. There's bullying by seniors from senior residents, senior PGs and administration happening weekly. Next is the Oxford Medical College in Karnataka, where respiratory medicine is toxic. Physical abuse is there from senior residents, senior PGs and faculty members happening daily. Next is the Kshema Karnataka Surgery Department, mental harassment is there from senior residents, senior PGs and faculty members happening daily. So guys, all this you can't fully depend, guys. It is all subjective opinions. So if there is any changes, like if at all you need to know the exact thing, you must go there or you must inquire with the postgraduates currently there whom you know. Please do that before making decisions just alone based on this list alone. So next again, yes, RIMS in Karnataka, surgery, verbal abuse is there from senior residents, senior PGs and faculty members happening several times a week. Next is the Basaveshwara Medical College, Karnataka, surgery, verbal abuse is there from senior residents, senior PGs and faculty members happening weekly. Next is Gandhi Medical College in Madhya Pradesh, where surgery is toxic, verbal abuse from senior residents and senior PGs happening several times a week. Next is the Sri Devaraj URS Medical College in Karnataka, where surgery, OBG are toxic, physical abuse is there from senior residents, senior PGs and HOD happening daily. Next is the NRS Medical College, West Bengal, where surgery and respiratory medicine, there's discrimination based on gender, caste, religion, region, etc. and from senior residents and senior PGs happening several times a week. Next is the Mahatma Gandhi Institute of Medical Science, where orthopedics and ophthalmology are toxic. This college is in Maharashtra. Here again, verbal abuse like shouting, humiliating and abusive language from senior residents, senior PGs and head of the department is there happening daily. Next is the Rajashri Medical College in Uttar Pradesh, where OB-GYN, there is verbal abuse, shouting, humiliating and abusive language from senior residents, senior PGs and faculty members and head happening several times a week. Next is the NRS Medical College in West Bengal, where pediatrics, there's verbal abuse from senior residents, senior PGs and head of the department happening daily. And Shimoga Institute of Medical Science, pediatrics and ENT, verbal abuse is there happening several times a week. AIMS Patna in Bihar, OBG, verbal abuse is there from faculty members and administration happening daily. Next is the PTBD Sharma, PG IMS Rohtak in Haryana, biochemistry, there's mental harassment from head of the department happening monthly. Next is orthopedics in Kakatiya Medical College, Telangana, where head of the department, Toxicity, is there happening monthly. So that's it, guys. I'll be coming back with my next video where I'll be discussing more colleges and details about it. So till I come back with my new video, stay tuned. Till then, bye.